How do indolent and aggressive lymphomas affect prognosis? Imagine your body is fighting a battle against lymphoma, a type of blood cancer that starts in the lymphatic system. The way this battle unfolds depends a lot on whether the lymphoma is indolent or aggressive. Indolent lymphomas are slow-growing. They tend to grow quietly over many years, sometimes up to 20 years or more. Because they grow slowly, patients often have a better long-term outlook, but they usually cannot be cured in advanced stages. Early-stage indolent lymphomas, like those caught in stages 1 or 2, can sometimes be treated successfully with radiation alone. Even when treated with immunotherapy or chemotherapy, these lymphomas often come back over time, meaning patients live with the disease as a chronic condition. They may need ongoing treatments to manage symptoms and side effects, but many live long lives despite the disease. On the other hand, aggressive lymphomas grow rapidly and spread quickly. If not treated promptly, they can cause serious health issues in a short period. Fortunately, aggressive lymphomas are often potentially curable with intensive combination chemotherapy. Cure rates in many cases can be over 70%. Most patients who respond well to treatment see remission, and many can achieve long-term survival. The key is quick diagnosis and immediate treatment because these lymphomas tend to relapse within the first 2 years after therapy. A complicating factor is that some indolent lymphomas can change into more aggressive forms over time. This process is called histologic transformation and usually indicates a poorer prognosis. About 1 in 5 patients with indolent lymphoma may experience this transformation during their lifetime. When it happens early, within 2 years of diagnosis, or if the patient has had prior chemotherapy, the outlook tends to worsen and more aggressive treatment becomes necessary. When we look at quality of life, studies show that long-term survivors of both types often report similar overall well-being. However, living with indolent lymphoma often means managing ongoing disease and treatments, which can be a long-term challenge. Survivors of aggressive lymphoma, especially those who achieve remission, might face different hurdles, including the effects of intensive therapy. In summary, indolent lymphomas grow slowly, tend to be incurable in advanced stages, and requiring long-term management. They often have a good prognosis over many years but carry a continuous risk of relapse. Aggressive lymphomas grow quickly but can often be cured with prompt, intensive treatment, offering hope for long-term remission. The chance of transformation from indolent to aggressive lymphoma adds another layer of complexity, often signaling a worse outlook. Always remember, treatment decisions depend on individual circumstances, and consulting with healthcare professionals is essential to understand the best options for each person.